Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Thanks for joining us. A couple quick updates. This morning, GoLocal had a story about Kent Hospital laying off 7 dialysis nurses. We're going to have a bigger update on that. The company that they're bringing in to replace the local talent has an interesting track record, to say the least. About $1 billion in federal fines and whistleblower penalties and settlements that have been incurred by that Denver-based company over the past decade. So take a look at that. Second of all is, and we'll explore a little about this, the LA Times had a piece off research from Los Alamos Laboratory on the West Coast yesterday. We picked it up today and took a look at that. About this behavior of this virus and some questions about how it is morphing over time. Also, the governor will have her press event this afternoon at 2:30, not 1 o'clock. And yesterday's announcement that everyone starting Friday needs to wear masks generated a lot of comments and a lot of reaction across the state, both pro and con. Let's go to Dr. Michael Fine, former Director of Health for the state of Rhode Island. Dr. Fine, thanks so much.
Thanks, Josh. Good to be here as always.
Let's go to the numbers. The numbers paint the picture, and they are relentless across the country, across the world, and in Rhode Island.
The numbers aren't changing. 1.259 million recoveries around the world. 3.75 million tested cases around the world happening. We're adding 80,000 a day consistently, sometimes more. Deaths around the world at 259,000. That's going to keep going up as this gets itself into the densely packed parts of the developing world. In Rhode Island, we are in the United States, I'm sorry. We are at 1.2 million cases, going up at 24,000 or so a day. That's been pretty consistent, sometimes up, sometimes down, but not significantly down. With 72,000 deaths, about 2,300 deaths a day. That isn't changing, and I think we've talked about predictions that say those numbers are going up. Today's Rhode Island numbers aren't posted yet, so they're the same as they were yesterday, and we had 14 new deaths and had pretty stable hospital use. That's a good thing, and consistent growth. We'll probably see bigger growth in our positives as we probably tested more people yesterday than we did on Monday, which was a holiday for some people.
Dr. Fine, the numbers just are relentless. They are just consistently, it's Wade Boggs, right? It's singles and doubles every single day, nonstop. And as states, I think it's up to 42. I don't know if Rhode Island is becoming less restrictive or more restrictive. Monday's discussion was about loosening things up and potentially eating outside and a number of things like that. And then yesterday was a new executive order, and arguably from a personal standpoint, the most restrictive executive order issued by the governor, that all people in virtually all situations need to wear a mask indoor and outdoor. The exception being their home, those who have health issues, and those children who are quite small. Are we going to be yinning and yanging forever? More restriction, less restriction, more restriction, less restriction, or will we come up with an actual significant policy that folks will understand and can plan for?
I think we're going to be playing a little bit of whack-a-mole. Remember, all of us are getting this disease over the next year. And the level of frequency of new cases is going to be a function of the level of our social distancing. As we increase movement a little bit, we either from a policy perspective or just what people do, the disease will rise to the new distancing until we've all gotten the disease. So, I think we're going to be doing a little bit of, when we get an outbreak, trying to slap it down, and learn to be tracking those outbreaks and coming up with interventions to try to control the pace of it. I'm a fan of masking, as you know. I think we're going to have a lot of things that are more restrictive than we have now, and it's going to great. But I think that's what the public health is going to demand, because at the same, we are, as we usually do as a people, want two contradictory things. We want more freedom and less disease, and it just doesn't work like that.
Do we run a risk? Listen, you've been around, you've seen as many in modern history of public health issues, but do we run the risk of really some, I don't know if you want to call it civil disobedience, just lack of compliance on this thing? You're hearing these horrible reports around the country of security officers in dollar stores being shot dead for asking people to put their masks on. Do we run a risk? We do have this spirit in America that is different. It's not queuing up like in London. How do we manage those things? The disease and the Americanism of this.
I think it's expectation management and patience over time. When there is a new regulation, it grates on our souls in a certain way, but then we get used to it. And the challenge is to come up with reasonable regulations. A good regulation is one that absolutely nobody likes, but that nobody's so angry about that they want to blow things up. But come up with reasonable regulations, stay the course, make sure people understand it, and be willing to change if we got the regulation wrong, because sometimes we come up with stuff that's a little too restrictive without meaning to. We're trying to balance the need for freedom and the need for public health, and there is no perfect formula for that. I'm a favor of more enforcement. I think you're going to need some enforcement, as painful as that is, if we're going to have the outcomes that we want. And the challenge is, are we willing to put up with more enforcement to get to those outcomes? I think places that are severely affected are more willing to accept restriction than places that are not so severely affected. And we may have to recognize that, and not have a one-size-fits-all policy, but understand that there may be need for, some differences place by place in order to actually address the prevalence of the disease in places that the disease is widespread.
The New York Times has a piece about a sort of coronavirus-like disease affecting small children. Were you able to did you get a chance to look at that piece? This seems to be hitting young children, infants all the way, toddlers, etc.
I haven't seen it, but I've said before that diseases behave the way diseases behave. So as the coronavirus gets more prevalent, and as we go from 1.2 or 3 million tested cases to 50 million cases, we will discover expressions of the disease that we haven't seen before because our numbers have been too small. That's kind of the way we learn to recognize disease. I knew from the beginning that the claim that this wasn't going to affect children at all was on its face untrue. We know from flu that we see the adverse effects on kids not when there are 50,000 cases, but when there are 25 million cases. You have to see more cases in order to get the full expression of the disease, and then have the scientific process begin to recognize those cases and group them and create syndromes and descriptions. We learn things as we go along as the disease spreads, and we will with this as well. There will be things that we don't know today that we will know in a month or two. We have learned things over the past couple of months about the presence of kidney failure when people are in hospitals that we didn't know on the front end. And we've learned about how the heart is involved that we didn't know on the front end. And I promise there will be 20, 30, 50 things like that that we learn as time goes by. We just have to have the humility to remember that the disease is in charge, we're not. And our job is to watch, listen, understand, and then try to find a way to mitigate the adverse effects.
As you know, your comments Monday got memorialized into a piece yesterday on GoLocal about the impact that Central Falls, Pawtucket, and to some degree Providence are suffering through. Are we going to see any change in how we're addressing that issue? I know you're at the front lines working with the two mayors. Do we see a greater emphasis by state or even federal officials trying to help break that curve, which is just nonstop upward and is so significantly higher proportion of Rhode Island's population than any other place in the state?
Well, I hope so. But I think it needs to be informed by data. So I want to make sure that we're not overreacting to an epidemic of tested positives, by which I mean to say, if there are a bunch of people positive and no one were to be hospitalized or dying, then I think our approach might be more restrained. We've heard case reports of deaths in houses that have me quite worried. And so I'm hoping we'll be able to look at city by city data around hospitalizations and deaths in each community that inform our choices. And then, if this is causing real public health impact, then I hope we really can bring in many resources to do many things that we're just beginning to do, both here and in Providence, to really up our game and protect the people who need protecting from what they need protecting from. We're not going to be able to stop this disease. Everyone's going to get it. But we are able to make sure that people who are in their houses and are getting sicker have access to care when they need it. We're going to be able to make sure, I believe, that people who are in densely packed houses and are the only person there can isolate out of their houses so they don't spread it with such intensity to their own families. These are the things that we need to be in touch with every household. These are the things we're working on, and I hope we can develop the resources to deliver on.
Dr. Fine, we're at the beginning. We're at the beginning of the warm weather, and if there is, any one period of time in which we see dramatic personal behavioral change in Rhode Island, we've come out of the winter. We've not only come out of the winter, but in this case, we've come out of the winter and we've come out of lockdown. How are we going to handle from a public health standpoint, manage this massive desire for 1 million people in this state, and in all likelihood, other people from Connecticut, and Massachusetts, and New York, and New Jersey to want to come here and enjoy Rhode Island? How are we going to stay? The governor tried to have a little skirmish battle with the governor of New York over anybody coming from New York is locked up for 14 days. That didn't really work. Nobody's really got ticketed. Nothing really happened there. How are we going to handle this when now it's really money time?
My guess is we need fast science. That is, we need to work with our smart epidemiologist colleagues and find a way to look at people on beaches and find out whether they are really at risk or not. And, is there risk if you sit on the beach the way we're used to sitting? Is there less risk if we spread out? We need some science in order to sort of make these determinations. I can't tell you that I know that sitting outside of a restaurant is safer than sitting inside of a restaurant. And I suspect it is, but I don't know it. But we've got people who know how to do the science. We ought to put them to work doing the science. Even people who are out of work, we ought to be able to put to work doing the science and do it fast, see what we can use to sort of get reasonable data, and then change what we do to let people do as much as we think is safe as soon as we have evidence that supports that it's safe.
If there's one guy in Rhode Island that has the magic 8-ball that works exceptionally well, the scientific version of the magic 8-ball that you shake up and come up with the answer, absent a vaccine, how long are we at this?
I think we're absent a vaccine. We're knowing what I know today and not having evidence about antibody and antibody development in the community. I think we're at it 12 to 18 months. Absent a vaccine, and we have to wait for enough people to develop enough immunity to start to drop our guard, and we're far from that, unfortunately.
Dr. Michael Fine, you get the last word today.
I think we can still do better than we're doing. I think we're falling back into our own patterns and letting the smart money make the smart money calls and having everybody else fall victim to what the smart money wants to do. I think we got to do better than this. It's time to step up our game. It's really time to have a whole society approach to this where we get together and stop fighting with each other about whether we're going to have this restriction or that restriction. Let's accept that there are going to be restrictions, work on this together, get it solved as best as we can, and not lose our trust in each other, because that's what makes us the people we are in the place we love to be.
Dr. Michael Fine, as always, thank you very much, sir. For everybody else, stay tuned. More coming up on Go Local. And also at 2:30, the governor will have a briefing, the first one since her announcement of the mask restriction, which definitely sparked a lively discussion in Rhode Island. Thanks, everybody. Stay safe.
Thanks, Josh.